I'd like to turn to our panel now. Dr. Howard Hite is a pain expert, but he deals extensively with primary care doctors. How do you convince the primary care doctor that urine drug testing is important and they should do it?
Well, Bill, what I want to go over with a primary care doctor to strengthen the limitations of a urine drug test. A urine drug test is an important clinical tool to use that will benefit the healthcare professional and his or her patients. We all know on this panel that you cannot tell a book from its cover. There are absolutely no pathognomonic signs of addiction, misuse, abuse of controlled substances. There are no pathognomonic signs of the criminal act of diversion. Therefore, urine drug test could be an invaluable tool to help identify this population. Certainly, urine drug test aids in the diagnosis and the treatment of the disease of addiction, and notice I said the disease of addiction, not the moral failing of addiction, or drug misuse. Urine drug test gives objective information to support the subjective symptom of pain. In pain management, it provides objective documentation of compliance with the mutually agreed upon treatment plan in a snapshot of time to be recorded in the medical legal record. And I want to emphasize to be recorded in the medical legal record. The primary care doctor has to look at the results, interpret the results, and determine whether the results should make a change in the treatment plan or not. Urine drug test is invaluable to advocate for the patient in family or social issues, workman's compensation, Social Security disability. A urine drug test that is appropriately positive and appropriately negative could aid your patient in these situations. I want to emphasize as strongly as I can, urine drug testing in a pain population should be patient-centered and not forensic in nature. In other words, it shouldn't be chain of custody. There shouldn't be observed urine. We have to remember we're doing urine drug testing for the benefit of the patient, not to the patient. You don't use a urine drug test to kick the patient out of the practice. You use the urine drug test to increase education and communication with your patient. The key, very important in urine drug testing, if you do not test, you're less likely to identify misuse or addiction and miss what is called the golden moment. What is the golden moment? That's the opportunity to address a very treatable medical problem.
Well, Bill, I agree with what Howard is saying. These are important points. But in addition, I think we want to be able to help protect our patients, but also emphasize that drug testing is a help to the public as well. We really can't be naive in the sense that we see drug misusers. We know that there are large numbers of people with the disease of addiction in our practices. And in part, it's our responsibility to protect the public by identifying these patients and then implementing a treatment plan to help them. In addition, drug diversion is a major problem in our society and it's very hard to detect. However, urine drug testing can be an aid in that detection process as well. So by testing, we can get an early and accurate identification of noncompliance and supplementation. We can also detect the use of illegal substances that the patient might be ingesting, and we can identify potential drug-to-drug interactions which could be lethal. So if testing can be an aid to reduce drug abuse and misuse, we're safeguarding our patients and their access to beneficial pain therapies.
Well, you know, I understand this, Michael, but you know, pain practices are one thing. I know my patients. They've been around me for 20 years. I know when they're having problems or not having problems. How do you get around that perception in primary care that we know our patients so well, we're going to identify those that are in trouble?
Well, I think it's important to validate that doctors do know their patients and that family medicine doctors know a lot about their patients, particularly those who have been followed for a long period of time. But I think if you do the math, the time you spend with that patient, even over 20 years, is a tiny fraction of the time that they're on their own without you. And they have the opportunity to do a large number of things. And we know that they make decisions about their health care without consulting us, simply about whether they take the medicine or not. And so the likelihood that they might be taking matters into their own hands in a number of ways that we wouldn't agree with is very high.
I have primary care patients. I see them for 20, 30 years almost at this point, and I have identified people I never would have predicted So it kind of comes out of the blue, and I say, well, how in the world would they be doing that? But they're doing it. Howard, I'm sorry.
Well, let's make another point. As an addictionologist, we must know, on the average, 10% of the population has a disease of addiction. So why is my practice, your practice, different from any other practice? 10% of your practice has a disease of addiction, excluding nicotine, which is 20% in this country.
I concur of most of the points that have been mentioned so far. I believe also, to add another dimension, another facet to your concerns, is actually urine drug testing is not only to protect the patients, to protect the public, but also to protect your own practice. It's important that for all of us to be able to preserve our practice by doing urine drug screening for patients. It is now most of the federal and state agencies and now on alert on the opiate prescription because of the epidemic that CDC has announced. So several media agencies, if you noticed, that they have been focusing and they've been publishing about the opioid misuse and abuse. It is becoming an area of major interest for our public. So it is important right now that you incorporate urine drug testing within your practice to be able to protect the practice, to protect the public, to protect the patient, and also being a reasonable and responsible thing to do. We know, as Bill said, it's not really easy to incorporate right now with your busy time, but we take the time to check the blood pressure to see compliance with blood pressure medication. We take the time to do glucose monitor to see if the patient has enough insulin or enough glucose medication. So it is important for us right now also to incorporate urine drug testing to monitor opioid medications.
Houman, you bring up a good point. I can remember the time when we only had urine to test our diabetic patients and how inaccurate that was. Right now, we aren't even at the urine stage of monitoring our opioid taking patients because people aren't testing. We know that less than 10% of the primary care audience is testing the patients when they're taking opioids. So why is it important to document that? I think it's important. We do it all in diabetes, but I don't think we're up to speed now with opioid use.
It's extremely important. On our practices right now, everything's about documentation. Documentation will bring out compliance and also will bring out further cooperation with the patient. If we do not do this, it's very hard for us to conduct our practice forward and be able to give the patient the best care that they deserve.
And if you don't document in the clinical chart, it's a figment of your imagination medically, legally.
I agree with that.
You know, Michael, I think doctors are worried that if they get it in the chart, they're going to be more liable if it's there. How do you talk to the doctor about their worry about it now being there and then I'm going to be in trouble because something shows up?
Well, what I tell physicians is that you can be sued for anything. Anything you do, anything you don't do. And so it's important to stay focused on what are best practices for your patient and your practice and the rest of society. So documentation is really an important element of that. It can't consume your whole practice, and you can't produce a document that would stand entirely on its own. You'd just never be able to do it. But it is important to have the key elements and then to incorporate that documentation into your future management.
This has been an excellent discussion. In summary, I'd like to bring up the key points. Drug abuse is epidemic in the U.S. population. It's difficult for us to identify who actually is abusing the drugs. And testing aids in protecting not only your practice, but the public as well. Testing gives us an objective documentation that you can have in your chart, and it supports for advocacy for your patients so that they can continue to take the drugs. As a primary care provider, I know that we're all busy. We don't feel like we can do even one more thing. But I want to emphasize this is important. This is something we do in every other chronic disease that we manage. We have objective measures. It is doable in our practice. It is just another lab test that, again, we have to interpret, but we can do this. And I'd like to thank the panel members for helping me with this discussion.